Okay, my name is Mikkel Martin, and the vulnerable population group that I chose was prescription drug misuse and abuse and addiction. So during this PowerPoint, we'll go over health concerns and stuff like that. First off, though, I wanted to kind of describe the population. So according to National Institute on Drug Abuse, a prescription drug misuse, abuse, addiction is when a prescription medication is being used in a way other than for what it is prescribed. And the most commonly abused medications are opioids, CNS suppressants, and stimulants. Since 1990, the number of prescriptions of these medications have increased and the abuse has followed. So this has been a problem that keeps on increasing, and this population continues to grow. From the 2017 National Survey on Drug Use and Mental Health, over 18 million people have misused these drugs at least once in the past year. So, like I said, it's kind of a big population and it continues to grow. What makes this population vulnerable for increased health disparity? So I first wanted to kind of pinpoint what a health disparity is. So according to Healthy People 2020, it is a type of health difference that is associated with social, economic, and or environmental disadvantages. So some of those that fall under prescription drug misuse and abuse and addiction is socioeconomic status, age, mental health, cognitive, sensory, or physical disability, geographic location and level of education. So it affects many people, and especially because these prescriptions are needed for a lot of these people, and so it's kind of hard to distinguish when they can be used appropriately and not appropriately, if that makes sense. Profile size of population. So Utah County, I found this awesome graph kind of figure type thing from Utah County. Had like a city council about it, and they posted their PowerPoint online, and the mayor of Utah County was also helping with this PowerPoint, and I just thought it was interesting that over the years this problem has just increased. I mean, it's affected so many people, and it continues to grow. And I really like how this kind of shows the areas in different counties and how it's affected. So you can kind of figure out where you live and see how it's affected your county. Population size, so Utah compared to the nation. This graph was perfect to kind of see that comparison from America's Health Rankings. You can see Utah is the square, so they're the top line, and then United States are the circles, they're the bottom line. So Utah is well over the nation on how. And this is with drug deaths, so overdoses with drug deaths, injury, so unintentional suicide, homicide, or undetermined. I mean, it can happen from any of those ways, but with Utah, ours is very high, and that just goes to show how prescription drug abuse, misuse, and addiction is indeed a problem here. So size of population nationally, this was an awesome graph found. Same with America's Health Rankings. And this also shows all of the states and how it's affected. So the darker states is where it's affected more, and Utah here is pretty dark. So, I mean, on the other slide, you can see we were 22, and over here we fit in that category 21 to 26 with that shade of blue. And over on the East Coast, you can see that it's a bigger problem, but I mean, Utah, we're still a big problem, and I fear that it will just continue to grow if, nothing's done, and we need to really implement education for this population and help them out. Internationally, so according to article that I found on the United Nations Office of Drugs and Crime, 35 million people worldwide struggle from drug abuse, misuse, and addiction, but only 1 in 7 of those people receive treatment. So, this is also a worldwide struggling issue, and like I said, I fear that it will just continue to grow if we don't really implement things to help this population out. Contributing factors, so social determinants of health, include stigma, income level, educational attainment. We need to educate these people. Interpersonal, household, and community dynamics, family, social networks, and peer pressure. A lot of these people start as teenagers taking these medications. They find prescribed medication somewhere in their household and try and get a high off of them, and it just continues to be abused, and they lead to addiction, right? Same with if you have a stressful situation at home. This is a way for you to get away. This is often what people will turn to. Not a healthy coping mechanism. Also, availability of resources. Maybe there aren't very many around you. Access to social welfare systems. Like I said, maybe you're not able to access those. Compliance with medication. Maybe you don't understand how you're supposed to take them. Accidentally overdose, or say you're an older patient, a geriatric patient, and you can't remember if you take them, so you take them again. A lot of these can affect every single population. I mean, every single range of age and so forth. Other contributing factors are specific concerns. So physical environment. So housing and homelessness. I work at the ER here at the Utah Valley Hospital, and I find that this is a big factor. Those who are homeless will often continue to ask for prescription medications and stuff like that. And I try not to be judgmental, but that's just what I see, kind of the trends. And I think this is their way of coping with their living situation, is turning to these medications, which is super sad. And we try our best to help them. We get the social worker involved and everything like that, and try and help these people. Psychosocial, so the need for the prescription. These people do, I mean, there are plenty of people out there that need these prescriptions for their mental health, and for depression and ADHD, and the pain may not be tolerable, so they continue to take their opioids and such to help with their pain, but that can lead to addiction, and that's just how those medications work on the brain, and it's super sad. And then there's peer pressure. Like I mentioned before, these teens start young. These kids start young with these medications, and it just continues to build, and they continue to look for that high and that sensation. Economics, so being raised in a low-income family, maybe you're stressed, and this is your best way that you know of how to cope with it, and maybe it's easy for you to be able to start there, but it's just going to continue to create a bigger problem. So other contributing factors, root causes. So according to the Mayo Clinic, some of these root causes of prescription drug misuse, abuse, and addiction is they want to feel good or get that high. They want to escape, or relax or relieve some tension, to reduce appetite or increase alertness. Maybe they want to lose weight, so they want to start taking these medications, or to experiment with mental effects of the substance, to maintain an addiction and prevent withdrawal. I mean, they're addicted and they don't want to go through those withdrawal symptoms, so they're just going to keep feeding this addiction. To be accepted by peers, or to be social, to try to improve concentration, academic, or work performance. Also, some other contributing factors with Maslow's hierarchy of needs. So kind of just to see if they're met or unmet. So physiological needs are mostly met among this group. I mean, they're able to get the food and the water and the shelter that they need. I mean, there are homeless, but they can turn to those homeless shelters and such. But unmet is safety, love, belonging, esteem, self-actualization. If you are mentally impaired because of taking these prescribed medications incorrectly or overdosing, that puts you at risk for safety, as well as love and belonging. I mean, if you are trying to do everything and anything you can to feed your addiction, that can break a lot of relationships for you. I've seen it in my own family where stealing and lying comes into effect, and it's very sad. But they feel like they need this medication to function. And esteem and self-actualization, I mean, that's not going to be met either if you can't meet your other ones. So this addiction just continues to not help, I guess. Anticipated function level is low because, like I mentioned earlier, if you are addicted and that's all you can think about, it's going to be hard for you to keep a steady job, especially if you're stealing and lying. That's not going to be able to work for you. Same with safety and belonging. I mean, if you aren't safe, you aren't able to function correctly, then that's not a good place to be either. So likely health outcomes is overdose, death, and mental disorders. I mean, as sad as it is, that's what it comes down to. If continues to go and try and feed this addiction, a lot of times people will get to the point where they want to overdose and end their life, and they will, or they continue to just have mental disorders, and it just is so sad. Or even accidental overdoses. I mean, that's pretty common here in Utah as well. Um, so specific concerns, communicable diseases or infections. You have HIV, AIDS, hepatitis. That's due to the drugs. I mean, they impair your judgment, and often unprotected sex is involved, and those risky behaviors as well. Other non-communicable diseases include life expectancy, according to National Institute on Drug Abuse. This is kind of what they layered out. I mean, it's going to be shorter, especially if you overdose on those medications and end your life. And drug-induced liver disease, I mean, these medications, taking too much of them or consistently does damage on your liver. And same mental illness, it makes it worse. You get lung disease as well. That's a high risk. It puts you at a high risk. I mean, your immune system's not working well. So you really are susceptible to a lot of things. Same with, I mean, respiratory failure. You may overdose on these medications and stop breathing, especially with those opioids. And cardiovascular effects, and those can end your life as well. So abnormal heart rates, heart attacks, heart failure, stroke. Like I said, too much of any medication is never good, and a lot of these medications can cause those. Lack of self-care due to addiction. So other concerns, I guess, is what we're talking about. So self-care and self-harm. You're not able to take care of yourself because you're just thriving off that addiction, if it gets that bad. And same with prescription drug abuse, misuse may exacerbate mental disorders. So you may continue to get depression or worsening depression and anxiety, and it can end in suicide. So it's super sad to see this population get that low, but so that's why it's so important that we need to help them. So risk for harm or by or to others. So violence is definitely involved if you're driven by that addiction. Same with crime, traffic accidents. If you're driving under too much medication, that can impair you and cause driving accidents, which is super sad. Family deprivation, social, economic, psychosocial. You may be addicted and you're spending all your family's money, and that just puts you in an economic situation that's hard to maintain. Same with relationships with your own family. Especially this one always makes me sad, harm to children. I mean, they often will suffer from neglect, abuse, or even utero exposure to different substances. If a woman is pregnant and is consistently taking these medications, that does a lot of damage to the fetus. So what can be done? We talked a lot of sadness here, but there are solutions. So, I mean, there's plenty of detox facilities available here in Utah. I see patients get admitted all the time when they come into the ER, and we're able to find a facility for them. Counseling. So, same, we get the social worker involved. They help us find more resources to help with them. We can learn to strategize to function without drugs, know what to do when a craving does occur, avoid situations where drug use may occur, what we can find alternative coping skills and such. We can find addiction medications that help you counteract the drug effect on the brain and behavior. They relieve withdrawal symptoms, help overcome drug cravings, and treat an overdose. So there are things that we can do to help this population. Here are my references and a second page of them. And hopefully we can find more ways to help this population. Thanks for listening to my presentation.